Well, that's actually a common problem. Okay, so most of us, as we age, the normal process is, everything wears out, function declines, and erectile function is no different. Okay, so typically I'll have blokes coming in and it's not something they want to talk about, and again, it's not like it's an affront, because we will define ourselves by our erectile capacity. We're all great believers that we're great lovers. People can tell otherwise if they want, that's fine. But the simple truth of the matter is, guys will come in and they'll say, "Oh, I've got this list," and towards the end, it's the ones that you're most embarrassed about at the end. So that's when you either say, "Oh, I've got a bit of pain in my chest," because they might be having a heart attack, or, "Doc, things aren't real good in bed." And that's as much as they want to say about it. And so then you got to say, "Hang on, let's talk about this, because this is actually really important." And it's then a matter of establishing, okay, so wherein lies the problem? You're having trouble getting an erection, you're having trouble keeping an erection that's satisfactory for intercourse, or you're having problems with ejaculation. Okay? And again, once you start having these conversations, men are more inclined to speak more freely of it. But it's just that initial hesitation and fear and stigma about being the one to go, "Oh, yeah, I've got a problem." Well, that's okay. Lots of blokes got problems. I see blokes every day who come in and, take tablets for any number of reasons. There's medication we give that you can give you erectile dysfunction. There's just the stress of life that'll do it. There's just the fact that, you're aging. So there's lots of different reasons out there. And again, similar to like I mentioned before, when we're talking about mental health, if people come in, if blokes, specifically men obviously, come in and they're talking about erectile dysfunction, there's a series of things we should check to make sure there's not an underlying medical reason for that to occur. So you want to rule out a few different things, but typically speaking, they're all normal, and it's just age-related, it's psychological. There's lots of different factors, and they can be difficult conversations to be had. And you just have to accept the fact that, if we're going to fix a problem, this is what we need to do. And a lot of the blokes will come in and they'll say, "Oh, look, Doc, mate, I had a bad start with the missus the other night. Now I'm really worried." Then it becomes a psychological problem, because they're not in the moment. They're focusing on the past and trying to gee themselves up for a good performance. Well, they're psyching themselves out of the game. And then you have the conversation. So, "Mate, if you masturbate, how are you going?" They go fine, no problems. You go, "Well, mate, it obviously works then, doesn't it?" And so it's just that, they can say, "Look, I can masturbate every day and that's fine, but then when I'm with my wife, it's not as good." And then a lot of the time is, well, they need to learn to have conversations as well, not just with me as a doctor, but also with their partner as well, their wife, partner, whoever it is, spouse, whatever. They need to be comfortable having conversations, because I will get the partners come in here as well and say, "Oh, look, can you talk to him? It's really stressing him, but he doesn't want to talk about it." But there's options. There's medication that we can take. Medication is probably the most readily used and accessible option for guys that are having trouble with erections. There's a few other less commonly used things, but that's certainly the great starting point, and certainly where we would start as GPs.